my name is Kelsey Beers, and I'm going to be presenting about early literacy interventions, more specifically dialogic reading training. This dissertation work is authored by Margaret Shavlik in tandem with her faculty mentor, Dr. Amy Booth. I'm going to be going over some of the main points of Margaret's dissertation work, as well as talking more specifically about my experience working this summer as a McNair scholar. I did really enjoy this project as a McNair scholar, seeing as how the McNair program is basically an intervention program itself, seeing how early intervention with vocabulary gaps and childhood development can then lead to this academic achievement gap, which many McNair scholars also experience, made this study very personal and enjoyable for me. So thank you for listening to this presentation. To talk about the overview of the study, reading interventions have been highly valued due to their positive impacts on vocabulary development and future achievements. Though these interventions are designed to assist those in lower socioeconomic statuses who are more predisposed to falling behind their peers academically, these low socioeconomic status children do not reap the same benefits of reading interventions that their high socioeconomic peers do. This study aims to investigate some potential barriers to the success of reading intervention at the implementation stage with parents, rather than the child outcome stage, which has been previously researched. In order to discuss this fully, we need to understand some of the major barriers in place for achievement for children. There are two major barriers to the efficacy of literacy interventions, one being socioeconomic barriers such as poverty, lack of access to quality health care, and education level of the family. Home learning environments are very similar, though differ, because they include access to the educational materials at home, toys that are available to the child, and most importantly, the level of support and one-on-one time that can be devoted to the child's education. Lack of access to books is a very large issue in low socioeconomic status families and actually can fall under both socioeconomic barriers and home learning environment barriers. As the low income level makes it difficult to afford books, and the books are an important aspect of a high quality learning environment. So this can fall under both of those barriers. Understanding of parental literacy skill and education levels has not been very highly researched over the years, which leads us to ask whether the interventions themselves are less effective for low socioeconomic status families, or rather, are the intervention skills and procedures not linguistically accessible to these parents who may also have a limited vocabulary due to their own experiences growing up. Home learning environment is so important to childhood development, as it's been shown to be a better predictor of achievement than socioeconomic status by almost 2 times. Joint reading is when the parent and child engage in the same book reading together multiple times. And so this activity can foster strong relationships between the parent and child, as well as foster cognitive skill development that will benefit them in their academic careers. An example of this being sustained attention and executive functioning. By age 2, language and vocabulary gaps can already be detected, and 35% of the variance in language that children understand can be predicted by at-home reading habits, which we will go more into depth soon. Dialogic reading intervention specifically aims to start a conversation between the parent and the child, as coined by Whitehurst and colleagues in 1988. This allows the parent and the child to connect the book back to the child's life and engage in deeper conversation about what's happening in the book and what might happen next. These predictive skills and deeper conversation can introduce new vocabulary to the child that they might not have been exposed to before. This goes beyond simply reading the text on the page, and this specific intervention has been shown to have a larger effect size on high socioeconomic status families than it does low socioeconomic status families, unfortunately. Moving on more specifically to how dialogic reading system works, there is a PEER acronym, which is the sequence of reading, asking a child a question, evaluating the answer that they give, adding more information to that answer, and then having the child repeat that correct answer. This sequence helps to engage deeper in the book and remind parents that you need to be having a conversation while reading. The CROWD acronym is prompts that can be used in the prompt and expansion section. So these can be fill in the blank questions, asking the child what recently happened in the book, questions without a concrete answer, questions with concrete answers, and connecting the book back to the child's outside life. This study shifts gears from the child outcomes perspective of reading intervention and hones in on the implementation phase of these skills by the parents. If the parents are unable to fully understand and comfortably use dialogic reading skills, they may be less likely to try to use them with their children and may certainly be less consistent with using these skills, which may help us explain the efficacy gap of reading interventions between socioeconomic statuses. By simplifying the language use and offering another intervention strategy, this study aims to shed light on the parent's experience learning and using these dialogic reading skills. Study 1 is our classic study, which aims to answer the question, are the socioeconomic gaps present in the implementation phase with parents as they are in the child outcome phase? Study 2 is a language simplification where we bring the vocabulary from a 12th grade level down to a 5th grade level. This asks the question, how does language accessibility interact with education level? And study 3 is the active control, which asks the question, is dialogic reading intervention impactful beyond providing one-on-one reading support? As we know, encouraging reading support does help build these skills, but is dialogic reading the key to these skills, or can it just be any lab-based intervention? Moving on to the methodology. In study 1, we had 59 parent-child dyads who participated in at least one session, with the children's age being a mean of 3.84 and a standard deviation of 1.02. Education was the proxy for socioeconomic status. So looking to table 1, you can see how many families completed how many sessions based on their education level achieved. Study 2, the simplified study, included 58 parent-child dyads that participated in at least one session, the child's age being a mean of 3.89 with a standard deviation of 0.98, and education being used as the proxy. Again, you have the same chart, just with study 2 data. The active control condition is still undergoing data collection, and so the participant data is not currently available. Our classic dialogic reading intervention was based off of the Read Together, Talk Together Pearson education book. This included training through video, pamphlets given to the parent when they take their books home, cheat sheets on how to use dialogic reading, and 5 books to help close the access gap for parents who may not have books at home for their child. The prescribed reading was 20 minutes daily, which is the standard for dialogic reading, and the structure of participation is as follows. In session 1, they receive book number 1, which stays constant over all 3 sessions for familiarity, and they also read a book with the experimenter, which is book 2, as the experimenter demonstrates some of the skills that they learned in parent training. The first reading of book 1 is a baseline assessment to see how much skills they use naturally. They then receive 3 out of the 5 books available to them. And on session 2, they read their book 1 for familiarity. They receive a new book to read, another interview. They return the reading log so that they can see how constant their at-home reading was. They get 1 additional book, and they return for session 3, where they read book number 1 for familiarity, a new book, get their last interview, and take home their last book. The follow-up call happens just to see how often they use these skills once they finish session 3. Study 1 pamphlet, just to show you an example of the language used. It includes crowd sequence, peer, and dialogic reading, all of the traditional words that we expect from dialogic reading training. Whereas study 2 shows fill in the blank, stop to talk, and right or wrong, which we would know to be completion, dialogic reading, and evaluation. As these all have the same procedure, just with differing skills or language use, the study 3 teaches executive functioning skills of refocusing, waiting, and rule following. However, it is just as long of an intervention, but does not use the peer crowd sequence. My experience this summer is I got to code the executive functioning videos using the same dialogic reading coding system that was shown before using DataView. And this is to show whether or not these skills will pop up naturally using encouragement and support in the lab. Moving on to the possible outcomes of this study, it could be expected that the low education level families will start off with low dialogic reading implementation, and the previous literature shows that there will be a very small gain from the classic dialogic reading as it uses a lot of jargon. High education level, they get to keep that large jump because they have the accessibility to understand that vocabulary. For the simplified study, it would be expected that the low education level families have a higher chance of implementing more dialogic reading techniques since it's made accessible to them, and the high education level families may not reap the same benefit as they may think that these are things they've already been doing instead of having the new terms in the classic condition. And for our control, since we're not teaching dialogic reading skills, it should be expected that there is not a significant change between either levels, low education or high education, but they do start at those different baselines just due to the predisposition of their education level. For the discussion, childhood literacy impacts future success in both academics and across the board as they grow up. And although these interventions have been successful, they're not always accessible to their target audience. And these barriers, unfortunately, may be a part of a larger social issue that cannot be remedied by reading interventions that may rely on policy change and welfare support through book projects and social support systems. Thank you so much, both to the Ronald McNair program for funding my experience as we are first-generation college students with financial need. This intervention project really rang true for me, as well as a special thanks to Margaret and Dr. Booth and the rest of the Little Learners Lab for taking me onto this project, and to the Spencer Foundation and Vanderbilt University for providing support and funding to this project. Thank you so much.